Good afternoon, my name is Rafael Walker. I am a fellow with the American Hip Institute in Chicago, Illinois. I will be presenting this study on behalf of Dr. Lyle Ashworth and Dr. Benjamin Dohm, titled "Do Femoral Head Osteochondral Lesions Predict Poor Outcomes in Hip Arthroscopy Patients?" This is a match comparison study with a 5-year minimum follow-up. These are our disclosures. And the prevalence of chondral lesions in hip arthroscopy has been estimated at 72%. Femoral head lesions are less common than acetabular lesions, and the study question is, do femoral head chondral lesions decrease outcomes after hip arthroscopy? We did a retrospective review of prospectively collected data with a 5-year minimum follow-up, and we collected modified Harris head score, NAHS, HOS, VAS for pain and satisfaction, and we were able to match 96 patients, no significant difference for general demographics or radiographic measurements, including Tony's grade, alpha angle, and LCA. Intraop, we found that the AFH group had high grade acetabular cartilage lesions compared to the control group. So for the acetabulum, Ailey grade 4 and Aldersbury grade 4 was worse in this group. Intraop procedure, there was a higher tendency towards labor repair in the control group as opposed to the Bridgman or catheter application in the AFH group. Patient-reported outcomes at 5 years showed significant improvement for both groups, including VAS for pain and satisfaction, and the magnitude of that improvement was comparable between both groups. MCID was about 60% for both groups, and PAS score was 54 and 63% for the AFH and the control group respectively. Secondary or revision surgery for the AFH group was most likely a conversion THA in about 32 versus 15% of the cases at an average of 39 months. For the control group, it was most likely a revision hip arthroscopy in about 24 versus 5% of the cases. Multivariate analysis controlling for those variables showed that the AFH defect size was not found to be significantly correlated with progression to THA. Within the AFH group, 32 patients underwent total hip replacement versus 64, and we found that age, BMI, duration of symptoms, and the grade of the acetabular lesion was correlated with obtaining a THA. Preoperative NAH was probably the most useful tools in these patients, and we concluded that the AFH chondral lesions and hip arthroscopy is associated to worse intra-articular hip pathology, lower post-op PROs, double the rate of conversion to THA. However, when controlling for other variables, they do not necessarily portend a worse clinical outcomes, and they do not increase conversion to THA.